If you go under the knife today, you expect a very specific routine. You'll be given precise anesthesia. The surgeon marks a sterile incision. They'll be wearing a green gown, and they'll close the wound with stitches that dissolve safely inside your body. We tend to view this sequence as a uniquely modern achievement. However, the literal blueprint for nearly every step of this process was written 1,000 years ago. To find the origin of that blueprint, we have to look at the state of medieval Europe, where surgery was a despised trade. It was largely left to local butchers and untrained barbers who simply possessed the sharpest tools in town. Cultural barriers effectively froze medical progress. The prevailing religious authorities viewed illness as a divine punishment, leading to explicit bans on the teaching of surgery in medical schools. Undergoing a surgical procedure wasn't a medical calculation. It was a desperate gamble with agonizingly low survival rates. 2,000 miles away in 10th century Islamic Cordoba, the environment was different. The city was a center of scientific inquiry, and serving as the court physician to the caliph was Abu al-Qasim al-Zahrawi. Al-Zahrawi approached human anatomy with the mindset of an engineer. He refused to treat surgery as a brute force chore, viewing it instead as a delicate, life-saving discipline that required specialized tools and documented protocols. By replacing superstition with mechanical precision, al-Zahrawi established the professional standard that we recognize as the basis of modern medicine. Al-Zahrawi spent 50 years compiling his observations into a 30-volume medical encyclopedia titled Al-Tasrif, or The Method of Medicine. The 30th volume of this work changed the trajectory of the field by explicitly separating surgery from general medical theory and elevating it into its own independent science. Inside that volume, he detailed strict preoperative protocols. To manage pain, he introduced a soporific sponge, a sponge steeped in boiled aromatics and passed over the patient's nostrils to induce a deep sleep before the operation began. He instructed doctors to use ink to mark their planned incisions on the patient's skin and established the practice of wearing a green gown in the surgical room. These specific standards transformed a chaotic, terrifying experience into a standardized routine focused on keeping the patient alive. To prevent patients from bleeding out during operations, al-Zahrawi detailed the technique of ligaturing, physically tying off blood vessels with thread to instantly stop the flow of blood. This technique was so vital that 600 years later, the French surgeon Ambroise Paré would claim credit for its discovery. Precise surgery required specialized hardware. Al-Zahrawi designed, tested, and created an illustrated record of over 200 unique surgical instruments. Examining these pages reveals the same bone saws, obstetrical forceps, and speculums found on modern surgical trays. For closing internal wounds, he introduced catgut, a cord made from animal intestines. He chose this material because he observed that the human body could naturally break down and dissolve it over time. Al-Zahrawi provided the physical hardware and the internal protocols that make surviving major surgery a reality in the present day. This repository of knowledge eventually moved west. In the 12th century, Gerard of Cremona translated the surgical volume of Al-Tasrif into Latin. The arrival of this technical data dismantled the centuries of superstitious medical practices that had previously dominated European thought. European medical universities adopted the text as their absolute surgical authority, relying on it as a primary reference for the next 500 years. Because the book included meticulously scaled drawings of his tools, it served as a manufacturing guide that single-handedly established the European surgical instrument industry. As the European medical renaissance took hold, many physicians began claiming these methods as their own local discoveries, omitting their origin.